All right, it is Monday, June 16, 2025 at 1:30, and this is the Health, Housing, Homelessness, and Human Services Committee with Supervisor Luis Alejo and myself, Wendy Rudascu. We are calling our committee meeting to order. We are active on Zoom as well as from the Monterey room of the Government Center in Salinas, as well as from the District 4 Supervisor's Office in Marina. With that, we'll move on to item number 2, which is to receive a verbal presentation on the Monterey County Sheriff's Office Reentry Center. And it sounds like we have Charles DaSilva from the Sheriff's Office with us today.
All right, good afternoon, and thank you to Supervisor Leto and Supervisor Askew, Roxanne Wilson, and the committee. Appreciate you guys having me here today. It's an exciting time for me and I believe for our staff at the Monterey County Sheriff's Office, particularly the Monterey County Jail. My name is Charles DaSilva, and again, for those of you who don't know who I am, I'm the Director of Programs at the Monterey County Jail, and I'm excited to be here because this is an opportunity to share and educate our community about the new Reentry Resource Center. I believe that the Monterey County Reentry Resource Center is going to be an important milestone for this community. It's going to finally get us a journey towards rehabilitation and reintegration. I believe that the center is going to bring a place of hope, support, and opportunity for our men and women who are incarcerated at the facility. The idea around this goes back about 11 years. I started at the jail 11 years ago, and it's always been kind of a dream and a passion of mine to incorporate all of our community and the folks in our community who are doing their individual work out there, to incorporate and bring everyone together, working with us to make sure that we have a bridge to the outside, to make sure we're connecting these people to resources and support systems. For me, it's important to centralize services for our men and women when they're coming out, and for those who are on the outside who need services, who are outside alone, homeless, who need a place to go for some kind of support or just an hour of just sitting down in a safe place. And that's what the center is going to provide. We're partnering with behavioral health, we're community-based organizations, our justice involved, and county and state departments that hopefully, all together we can make some kind of a difference in our community. Services that are going to be offered there, probably mental health, substance abuse treatment. It's obviously resources, bringing them in to meet with these folks on an individual basis, to connect them to services on the outside, whether it's a program that's on the outside that we can get them to, or a housing program. I know I've been bugging Ms. Wilson's here for a while, and she's the one that kind of guided me here to kind of just to put our resources in place and to have people understand why we're doing this. And so housing support, public benefits, teaching them how to just, go and get their DMV information or just their social security information. So we're starting on the inside. We go out 90 days. We look at who is discharging within 90 days, and then our team meets with these folks on the inside. We set up a reentry plan with them, and then we connect them to services based on their needs, based on what they really need. As you know, when they come in, some of them are kind of at the bottom. They don't know, they don't have family to go to, or the family has disowned them, or they don't have any connections. So our job is to try to connect them. And some of them, while they're in there, they're doing their programs, and they have access to their family because they're now showing their family, hey, I can talk to you now. I understand what my problem is. And so a lot of those things do change. Those needs change. So we do a pre and post assessment on them. And so you'll notice that the post assessment, things start changing. No longer do they need a place to stay. Now they just need housing, or they just need a job, or they need a resource to go and help with their addiction or anything like that. So it's a center that's going to, I think, bring a lot of people together and families. At that center, we are going to have a centralized area for the children. Some of these men and women who have children can't afford babysitting while they're going out and doing, their work or meeting their needs or getting some help. And so we'll have a center there for them so they can be there with their family, with their parent, so they don't have to go and pay for a service or something. So it'll be a little section there for them to hang out with their family and also be a part of it, to understand, how they can help as well, and how we can help the children as well, to help their parents become better parents, right? And successful parents. That's what we want. We want successful parents in our community. So for me, many of our clients, they face barriers: employment, housing, healthcare, mental health, and then without these supports, obviously there's a risk of reoffending again, and those people, it increases. And so that's why, thinking about this center, I thought it would be a great opportunity for us to bring everyone together, not work in silos, and work together as a team, as a community. It's successful. For me, this is going to be a successful reintegration for a safer community. It's a model that's going to create stability, which in lieu will reduce recidivism, and then everyone in the community benefits when these individuals thrive. I know that it could be one of my neighbors, and I'd rather have a neighbor who's going to be successful than someone who's always going to be in and out of jail. For me, that's important, and to help them grow while they're inside, and then connect them to the outside. Obviously, it's a hard process, and so to at least guide them and to give them the resources, meet them halfway, I think is at least what we can do. Help them with job readiness and placement. We do meet with them on an individual basis, and we do work with them on the inside. So this organization, this building will provide that. We'll have opportunities at computers to write resumes, type in the resumes, to work on a computer if they don't have one at home, to come in and just spend some time there to get. Some of these guys and gals don't understand how to work a computer, so it'd be a perfect opportunity to teach them and show them how to surf the web and things like that. Stable housing equals better outcomes. I've been working with Ms. Wilson here, and and so if we can kind of open up that door to help them to understand what's out there. Some of these men and women don't understand what's out there. They have no idea what the resources are, and so this will be a place to educate them, to help them, find that helping person on the outside. Key benefits for me, it's connecting them to mental health services, substance use support, and general medical care. We're trying to connect with our local folks, and with behavioral health, we already work in tandem with them, so they know who we're working with and who we're dealing with. And so it's just kind of tightening the belt a little bit more and understanding what better services we can create. They come in within 14 days, behavioral health does, and they come and do assessments on them, and making sure that we can connect them to behavioral health as well. Social services, we're working with social services as well and helping them out, understanding what programs are out there for them and their families. Again, personal case manager, this is where I think is a change at the jail with my staff, the program staff. I'm blessed with an amazing staff at the jail, and what they do is just incredible. They meet with these folks, sit with them, create a plan with them, they go over them. They actually give them the time of day to listen to their issues and what they have. And so to sit down with them, do a 15 to 20 minute, sometimes 30-minute interview with them about what they're going through and what they need is definitely a key thing to a successful discharge. So we customize reentry plans for each one of them. So not everyone, like the past presentation said, we're all different, and we come in different packages, so to speak, and so we have to treat everyone individually. And so to me, that's an important key that we're doing now as they discharge. They have their own individual resources and packages that we create for them. And then support from the reentry, we're looking long-term reintegration. I don't just want to set them up with something that's just going to fail. I want to make sure that there's a connection there. And so having that resource center there is a long-term idea for me, that as they go out into the community, they have a safe place to come back to with a familiar face and that connection, so that they can feel that there's an opportunity there. If they do fail, they can still come back. Instead of going to jail, come to the center and come work with us. Come work with that person that worked with you who was on the inside. And I think that's an important thing, a different change in how we're doing things as well. Obviously with this comes tracking. We want to start tracking our progress and refining the strategies that we're doing, looking at software, reentry software that's out there specific to just reentry, and how people are kind of tracking them, making sure that we're connecting with their providers or employment providers, housing environments, where they're going, so we kind of keep them in the loop so that our folks can go out to the community and meet with them out in the community as well. And then this also ensures accountability for us and then a measurable impact, because this is, we are working with taxpayer dollars and grant money, and I think that's fiduciary, responsibility on our end. The grant money is key. We have to report to the state what we do, and so it's just a form of accountability to have those tracking systems in place. A path forward for me is continued collaboration. For me, that's critical. It's not just the Monterey County Jail, it's everybody, it's a community. And we're all working with the same folks, we're working with the same people. And to me, that's important. I think working together as a community, we're gonna have a better support network, and it's gonna assure more holistic care, I believe, for these men and women. And then commitment, to me, I'm a guy who's all about second chances. And I think some of us were given probably the wrong deck of cards and didn't have a couple aces in there, and so I think it's important that we restore dignity and hope in some of these men and women, and then help these individuals to build meaningful lives. And so for me, that's one of the key goals for this center. And again, deep gratitude to all of our partners, behavioral health, folks that we work with in making this happen. And then, if we can commit, we can shape a safer and stronger community with Monterey County. Again, today, we're laying a foundation for the future, and I think just a small modular is going to be something big in our community. So again, we're about changing lives. At least that's what my program's about at the jail, and in creating a long-lasting impact on people. Thank you. Any questions?
Yeah, thank you so much for the presentation, the verbal presentation today. We appreciate having you here. I know keeping us updated about the status of the project was something that I was interested in staying abreast of. So I did have a couple of questions, but I'll pass it to Supervisor Alejo first to see if you had questions, and then I'll jump into mine.
No, I just appreciate having this presentation, because when we talk about public safety issues from the Sheriff's Department, it's often the jail, patrol, but we rarely hear about the support that we're providing for inmates. And I know I've seen some of the news coverage of some of the programs that help them even before they get out. And obviously, your services, it's imperative. The state had a major shift, right, with AB 109, inmate populations that would otherwise go to the California Department of Corrections, or many of them are now housed here locally. And certainly our goal is to not have them make the same mistakes they made previously, and you giving them that kind of support with the wide range of issues, it helps them keep that recidivism rate low, and hopefully get them back on the right track, and find those other opportunities that exist versus going in and out of our jail system. So I just want to emphasize how important this work is, and it sounds like you really have the passion and you believe in this. But for our public, this is also part of that critical public safety. So we're not having to spend public dollars housing them in a jail, or having our patrol having to respond to crimes. Let's get them back on the right track and not make the same mistake. And in the end, that benefits all of our communities, and it keeps us safer as well. So I just wanted to salute the work that you're doing, and the added programs and those opportunities to help them connect with resources that are available out in our communities. Thank you. So thank you for your work.
Yeah, definitely. Yes. So I guess some of the questions that I have are related to the funding, the CalAIM dollars that are helping us move this initiative forward, and the way in which, I know one of the things that came up for us at the department heads retreat that we had, gosh, that must have been back in March, was opportunities to have our departments working more closely together on some of these initiatives. So I don't know if you could maybe share a little bit more about the funding and about the departments that are working and sort of what the model for that collaborative working relationship is currently looking like.
Sure. So the Cal-AIM grant was Path 3 funding, and it was $5 million that we received. And that $5 million covered the modular and several positions that we have working, 2 deputies, a couple civilian staff or so, and then obviously the program itself, the software and things like that that go into creating this project. We're working collaboratively with behavioral health, with social services, with some nonprofits out in the organization. We are working with obviously our state partners with DHCS and connecting with us and helping us kind of move this forward. And then we have what's called an ECM, an Enhanced Care Management focus as well that comes with Cal-AIM, and we're looking at some of that funding going towards that as well. And that's someone who will help us take what we're doing on the inside and then continue those obviously metrics or those resources on the outside, connecting them to the outside with medical and mental health and those specific areas. And so it's not, $5 million goes quite fast. So with that comes, we do have a biller that we're going to be working with so we can build some of these services so that we can keep the program sustainable. And that's kind of the goal, is looking at other avenues to sustain this project in the future.
Great. And with the partnerships that are in place, I know just sort of similar to how the Rainbow Connections it takes sort of all the coordination to bring everyone together. Is that with weekly meetings, or maybe you could talk a little bit more about what the coordination, the structure of the coordination is working? Sure. Is it a team of folks that have been identified? And are there dedicated folks from social services who've been assigned? Is it a department head level, or do we have folks within eligibility, social workers?
It's a little bit of everything, and it started weekly. Now we're at monthly, but we still connect with social services on a weekly basis, because our 2 deputies who are the case managers inside the jail work with social services, identifying those who are out 90 days who need Medi-Cal, and so they work with them. So there's different variety of different check-in points. I know we meet with behavioral health on a weekly basis. On MDT, we talk about those folks on a weekly basis. Every Tuesday we go to MDT and we talk. And so at the administrative level, probably once a month. And then there's different forums like these where we meet and we talk about some of these projects that we're doing, and we connect with each other. Like that's how Roxanne got me here. So working with Roxanne and folks like her to connect me to the community. So that's been my goal, is to start to reach out these past several months with the community to start educating these organizations, and that's why I'm here today to anyone who I'm soliciting myself to go out and to have more presentations out there so that we can connect the bridge to the Monterey County Jail.
Great, thank you. And so then with the number of people so it's 90 days post release, 90 days pre-release, the folks would then have eligibility to start working with the re-entry center to receive, to get hooked in with Medi-Cal, get hooked in with all the services. How many individuals do you foresee on a monthly basis having contact or receiving services through the re-entry center?
So our goal, and with our new chief, his goal is that anyone who goes through our 90-day program is to discharge through our re-entry center, not through the intake where they came in. So it's obviously volunteer-based, so we want to make sure that we connect these folks as soon as we can. So we have a 14-day assessment. We meet with them at intake. Some of those folks don't stay too long, right? They're there for 3 days and leave, or some of them are 72 hours and they're gone, right? So it's those folks that we're looking at, what Supervisor Leo's at the AB19ers and those guys that we're looking at, they're doing long-term, a little longer terms, and then those who actually want resources. So right now, we're working about 15 or so a month or so. It's been kind of that number. We're thinking it's going to increase here sooner because the word's going to get out here soon. But again, it's also ebbs and flows because we're looking at seasons. In the jail, we work in seasons. When it's the winter time, the numbers go up. Summertime is kind of, slower. So it just depends on, again, how many people we have incarcerated and who wants to go through the program. But we are I don't want to say pushing, we are really going to these men and women saying, hey, this is probably a resource you want to take. We're advocating for them, and we're letting them know that you have these things in front of you if you want to utilize them. Again, I can't tell them what to do, but I can at least give them the opportunity and the resources in front of them.
Great. No, thank you so much. And I think, again, similar to our earlier presentation, it really comes down to having someone who believes strongly and is a champion, and who is sort of holding the commitment and holding the vision to get a program like this off the ground and up and running. And I know you've been that person really championing this vision and this program. So thank you for being here to present to us. I think having the oral presentation is fantastic. If you had a one-pager that had some more information and maybe a little bit of data, that would be great. I think it's one of the ways that we can then use some talking points and share information with potential partners, both in the community and with folks that I talk to people all day long. I know Luis is out in the community talking to folks all day long as well. And so that's a great way for us to be able to tell the story about what's happening locally, and people start talking, and that's how things grow. So if you're able to share that with us, that would be great. And then also just to the degree that I'm sure you also have some internal documents around sort of the structure of how things are getting organized and who's getting served. I'm very interested in paying more attention and monitoring and learning more about how that all is working and where the gaps are. I know you're aware, but I sit also on the Central California Alliance for Health, and ensuring that the ECM process is working the way that we want it to, and that all of the folks who you're touching through reentry are many of those same folks who are utilizing our Medi-Cal system of care. So the better we can get them connected when you're providing services, the better our entire system is going to be able to provide them with the broad base of services that they need. So I think our interests are aligned for so many reasons and in so many ways. So definitely appreciate you being here in the presentation today.
Thank you.
Hi, first of all, I'd like to thank you very much, sir, for your dedication to law enforcement and to the people that had made poor choices and ended up in a jail cell. I experienced personally the jails, as I am a former grand juror. And I was impressed with the jail when I toured the jail back when I was a grand juror. And as a mother of a child who was addicted to heroin for 13 years, she is now 2.5 years sober, and she is working for the Soledad prison system via Amity. And they're also really working hard on preventing re-entry. So she's giving back, counseling for drugs so they don't, re-enter and end up going back into the drugs. So I think that this is a very important program, and it's humane. Many of these inmates have never been treated humanely. Many have trauma from their childhood. And I think it's a very necessary program. Thank you.
Yeah, I'm excited to hear that there's programs being offered to people being released from incarceration. I think that's a big step in the right direction. My question is, if folks are going to be provided with housing assistance, I think that's my big question. And then also, if there was any plans to hire folks with lived experience, because that would give you know, people something that they could like look forward to as far as like possible job opportunities and way to give back. So thank you.
Salinas, Monterey County Homeless Union, West White. For this, I guess I want to give you a couple tips on like the Transformative Justice Center, if you're aware with them in Monterey, as well as Jacqueline Simon doing like the George Floyd, you know, trying to reimagine policing. And then, so I'm just wondering, do they have a piece of pie in this? You know, and like he said, the lead committee has a lot of, you know, people that have been in the system. So that would be a resource that we'd like to get a cut of funding. I mean, you know, if we're going to fight about contracts and paper and all this stuff. And then, of course, the big thing I worry about is the remainder. Who doesn't end up in these programs? Where are they going to end up? More than likely outside. And then they end up being my problem and your problem, and everybody don't want to talk about it. But there needs to be, like you're going to spend all this money for all these contracts for a handful of people, maybe a couple hundred or something, you know, in this time frame. And everyone who gets let out, we're going to spend all kinds of money getting rid of them. And that is like, you know, I mean, we need to be doing more of these kind of programs, no kind of sweeps, allowing people to have affordable housing that they provided for themselves. So, so yeah, no, money.
Thank you for the presentation, very informative. I really appreciate all of the work, Charles, and yeah, definitely send us some more information, and I would love to read through some additional information, and keep us posted.
Thank you.